last month, we introduced you to our newest expert, this one focusing on behavioral health. It's called Neurcore.
One of the areas they focus on is helping children with ADHD, a disorder usually treated with medication like Ritalin.
But today, Dr. Tim Royer, founder of Neurcore, is here today to talk about treating the disorder without using medication.
Yeah, and in a few minutes, we're going to meet a mom and her 10-year-old son who's being treated by the doctor and a staff. But first, we want to focus on the disorder itself, because everyone's heard of that, but maybe they're not sure exactly what it is. Can you explain?
Well, let me give you a little bit of history. In 1902 is when the disorder was first identified by a physician by the name of Dr. Still, which is kind of interesting, ADHD, Dr. Still. He called it a defect of moral control. It's kind of interesting. The name changed over the years. The one I like the best is 1960. They called it minimal brain dysfunction.
Oh,
which
wow.
Nobody really wanted their kid to have that, right?
No.
But now we know it as ADHD. And the thing about ADHD that's really kind of alarming is if you look in the last 20 years, the late 80s, 1 in 40 children had ADHD. In the early 2000s, 1 in 20 children got diagnosed with ADHD. Now, 1 in 10 children get diagnosed with ADHD. And it's projected that by 2050, 1 in 3 children will be diagnosed with ADHD.
Wow, that's incredible. So, Dr. Royer, is it because there actually are more kids who have ADHD or one of the related disorders, or is it because of something that's going on with the testing, maybe diagnosing kids who really don't even have ADHD?
That is a great observation, and that is the thing that we're very concerned about at Neurcore. If you had any other disorder that was growing at this pace, it would be an epidemic.
Right.
You'd say, what's in the water? What's going on? How do we go from 1 in 40 to 1 in 3? That's concerning, especially when we're talking about the brain. And I know from experience that it's not an epidemic of ADHD, it's an epidemic of poor diagnosing.
Okay.
What happens is you only look at the behaviors. Nobody ever looks at the brain itself. And in doing that, you're missing the individuality of each person, and you're only just seeing these symptoms, and we've been doing it the same way for 100 years. There's no other organ in our body that we would just diagnose based on behaviors. But for some reason, we do it the same way with ADHD that's been done for 100 years, which is just answer a few questions. Now I'm going to give you a diagnosis about your brain without ever even looking at it. And then the treatment is you're going to be on a controlled substance for the rest of your life.
Wow.
And you never looked at the brain? We're very, very concerned about this.
Yeah, it is interesting because it is seen as a negative thing that when a child is diagnosed with ADHD, they have behavior problems or they're out of control and can't be handled. So when a parent and a family comes in and has concerns about being diagnosed, what are you doing that's giving an accurate diagnosis? You know, giving that direction and being able to say, maybe this is something that is or isn't that?
Great question again, is that the thing that we want to do is make sure that we're exact with the diagnosis before moving on to treatment. We want a good roadmap and not just send somebody on a journey and not really make sure that what's going on, because we know that 60% of these kids don't even have ADHD. So we want to backtrack and say, if we're going to put something into the brain, let's look at the brain. And so we're going to do a scan of the brain and see what the brain is doing that's causing those behaviors. I mean, you guys know sometimes when you're really stressed or haven't slept well, guess what? Hard to focus, hard to complete tasks, maybe a little
Forgetful.
restless. Right. There could be thousands of reasons that little Johnny can't sit still in class, and it might not be ADHD at all. And so we have to stop, look at this realistically, not make the diagnosis in less than 7 minutes, which is usually how it happens. A lifetime diagnosis of the brain in less than 7 minutes.
And if it's by asking questions, you're asking these questions to kids that may be 5, 6, 7 years old, you'd barely believe them if you're asking directions to the grocery store. I mean, how does that even compute that that's how we would make that diagnosis?
There's some kids that we've seen that get diagnosed with ADHD at 3.5 years of age. Okay, I have 4 kids.
Yeah.
All of them had ADHD at 3.5, right?
Yeah, right, exactly.
Mother of a 3-year-old, I can completely relate to
I mean,
you.
how do you even, it's just unfathomable that you would give a 3.5-year-old a diagnosis of ADHD, but based on behaviors, hard to complete task, not focusing on the TV show that they're watching, of course, but that isn't, you're not respecting, one, the individuality of that child, and two, the developmental process. That's not ADHD, that's part of development.
Right.
Right? I think what a lot of people have a problem with a diagnosis of ADHD is the fact that you're putting a young child on medication, like Ritalin. And I have to think that this is one of the huge advantages to being able to make an accurate diagnosis, because, I mean, it seems like you're putting a child on a path in a wrong way, because that's going to really affect them in other ways in their life. Have you seen that?
Yeah, and a path with no exit strategy.
Right.
Okay? I ask parents, I say, next time you're in your doctor's office, say, what's the exit strategy for this medicine? And guess what? There isn't any. Okay, now, what other medicine do you take where you don't ask the doctor, well, how long do I have to take this medicine? But for some reason, we just assume, well, it's okay to put my child on a controlled substance for the rest of their life, and we might not even have the right diagnosis. That's concerning. That's an epidemic of poor diagnosis, which ultimately is harming our kids. I refer to it as pharmacological abuse.
Interesting. We barely scratched the surface here. You have a series of really wonderful educational seminars that you conduct, so people can come free of charge and listen to you talk about all of these aspects of what is going on in the behavioral health science. Also, you have a Peak Performance Institute as well, where you train high-level athletes, Olympians, business executives. Tell us about these seminars.
Yeah, the seminars, what we believe is that when it comes to treatment and training, is that you don't just do that to individuals, they need to be educated. And we're all about education. And I know that if you get education, you're going to understand, okay, this is the direction that is in the best interest of my child. So we provide these free lectures throughout the community. We have one in Lansing coming up, one in Kalamazoo, and then we have one in Meyer Garden. And these are free for people to come to. You can always come into our office at any time. You don't have to come to these lectures, but I really encourage people, they're free. Bring in your child or somebody who might have one of these concerns. Or if you just want to take your brain to the next level, which I think all of us do. I don't think anybody says, hey, I'd like my brain not to function very well. We all want to go to another level. That starts with good education, and we want to educate people. And we're the type of place that we're always about answering questions. The idea of having you come in and shuffling you out the door in less than 10 minutes with some type of script is not what we do at Neurcore. We're about educating you so that you understand how to take care of the most precious commodity you have, which is your brain.
Absolutely.
And you're offering a great special. The great thing is you're not going anywhere. We're going to continue to talk with you and the mother and son. There is an opportunity to get a great assessment. We're going to be exploring that in just a minute. Don't go away. We'll be right back.
This is 8 West.